for help for your food addiction and you don't know where to start? Welcome to the series, The Food Addiction Frontlines, where we uncover the expertise and services available for overcoming food addiction. I'm Dr. Vera Tarman, an addictions physician specializing in sugar and ultra-processed food addiction. In each 15-minute episode, we'll meet leading experts making a difference in this field. They will share their journey, their training, and the unique services that they provide so that you can find the treatment that is best for you. So welcome, Esther Helga.
Hi, Vera.
What inspired you to specialize in the field of food addiction treatment?
My own recovery, actually. I had struggled with severe food addiction and eating disorders for most of my life. And when finally I did get freedom from my eating and food addiction, immediately I felt very strongly that I wanted to contribute to the field because I knew that if I had had treatment and education about this disease, I don't think I would have had to suffer for as long as I did and so badly. I did want people to have the opportunity to get the learning and the understanding and real treatment for this disease.
Please share about your training and qualifications in the field of food addiction.
When I was beginning, that's 22 years ago now, we did have some ways of scanning the world through the internet at that point. I recovered quite a few, not so many actually, just like a handful of people that were doing something in the field of food addiction only, and not a lot of training or treatment. I entered a certification as an addiction counselor and addiction supervisor for addiction counselors. Then I was fortunate enough to meet with Phil Verdell and Mary Fushi at Acorn. They were offering a 3-year experimental learning about food addiction treatment. And I worked with them and co-worked with them ever after. Basically, they were wonderful. And with 2 of this, I started a treatment center here in Iceland in 2006. And it has been going ever since. And at that point, it was the first outpatient treatment for food addiction in the world, actually.
So
that's where we're coming from.
20 years ago.
Yeah, and it is still going on. And of course, the public only gets treatment here in Iceland. So just to take it from there, I was beginning to learn and get to know people from around the world that were doing treatment. And we got together in the Food Addiction Institute that was Phil started in 2005 or 6 around. And having had my diploma and certification as an addiction counselor, I felt that we needed to establish a school for professionals learning about food addiction and treatment for it. So I started it being really supported by you and like about 10 other professionals in the field. We gathered experts in science like Dr. Robert Lustig and Nicola Vena. And so many others I could name here to also lecture and work at the school. But the base of the school is taking the elements of addiction treatment, which is based on the American Society of Addiction Medicine best practices. So we set up a school that really teaches the professionals, not only the clinical, but also the scientific part of what the disease is.
And what is the program called?
International School for Food Addiction Counseling and Treatment.
And it officially opened its doors when?
The first cohort was certified in 2017. We have actually celebrated 130 new people into this new field, basically, which is amazing accomplishment.
Absolutely amazing. And many of the people who are now in the field of food addiction went through the doors of INFACT.
Absolutely, absolutely.
Which I think is just fabulous. What type of services do you provide or teach in the food addiction world?
Just to say a little bit about what the addiction treatment is considered to be, we would be teaching that at the infant school. First, we need to screen and assess the client. We have an intake process, which is getting all the background information for the client so that we can go ahead and individualize the treatment plan for them as we go forward. So if we're professional, we need to know this, how we're going to start the treatment. This is something that we've always done in Iceland at my MFM, which is the treatment center there. Then we have offered specific treatment seminars that have been from 1 month to 6 months to some people have been there for 3 years, depending on how much support a person needs. So we take people through the process of being abstinent. This is all based on abstinence and detoxification and going through the withdrawals of the abstinence. That's usually the beginning of the seminars. Since we have not been able to offer inpatient treatment for clients, which I believe is needed, very needed for most people, especially late and middle and late stage addicts to food. Then we have compensated with a daily support with counselors. Daily support, they send in their food. We also have them talk about what has been happening physically, mentally, emotionally for them in the past 24 hours so that we monitor with them. And then we put a lot of little things to do every day that will help them get grounded in the day and in their treatment program. We have groups. We start with a weekend, then we have groups every day. We have everyday support for the client for the time that they're there. And the ones that go all the way with our treatment have been taken through the therapeutic approach of the 12-step work as well. Once they go from treatment, they will understand why it is maybe important for them to continue with support from 12-step programs or something similar to that as well. That kind of a treatment does take time, and sometimes like a year. It probably will take 1 year to 3 years for people to really get treatment for this disease, as with any other addictive diseases. This is what we know. It takes time, takes a lot of support, and we need to have some action plans to what to do in order to change our personality.
Tell us about the program.
At the school, it is basically threefold, or actually 4 sections. We have the manual, which is the clinical guidelines going through the beginning to teach the intake and the assessments, the program planning, different counseling techniques, and different things that how we're going to deal with trauma, codependency issues, when we need to refer people to other professionals because of co-occurring problems. Then we have the second section as a treatment course, which is taking the students as well as clients. So we offer clients to come into the treatment and recovery practicum at the INFACT school, which is going on. It's going to be in the fall, a 15-week program where we take people through abstinence and follow them through until they have gone through the whole program of action in order to get and be able to stay abstinent. Then we have the third section, which is every student does a final project and presents it at the end of the program. And then the fourth basically is all of the lecturers that come in with their extra teaching through the period of the school, which is usually about 7 months, 7-month program. So we have you and Susan Pierce-Thompson, Amanda Leith from Shift, Marty Lerner from Milestone, Teresa Wright, the dietitian on food addiction recovery and on abstinence programs, and so on and so forth.
And this is all virtual.
I am actually working on setting it up, recording the whole thing. And so it's going to be more online on your own time, but there is going to be virtual as well. I am working on it at this point because I see that people have less time to just sit and listen for hours and hours. And so we're dealing with that at this point.
What would you say is unique about the INFACT program as a training program?
I do believe it is the only program that really works on the addiction part. Of course, so many deal with abstinence, and there can be so many different kinds of abstinences, but that is only a small part of the problem. The addiction part is where people, their personality has changed, and we need to help them reverse that personality change in order to be able to start dealing with life on life's terms. That's a basic way of saying it. We use a lot of teaching methods, of course. We introduce different counseling techniques, but I think what makes us special, maybe not so special because this has been done in treatment for other addictions since 1940, is that we present and teach people what the 12-step therapeutic approach really does for a client. I think what we're really saying that food addiction is not a diet problem or a health problem, it's an addiction problem. And if we deal with the addiction, the other will follow. People will get better health, they will get to the right size, and they will most of all have a renewed new life.
I would like to add that unique about your program, as more are opening up now, is that yours is still one that has a curriculum and a faculty that are part of the food addiction community for years, part of the research world, part of the clinical world. I'm thinking about Dr. Avina and Dr. Lustig and Susan Pierce-Thompson, myself. You hold the history of food addiction and how it's developed, so that anybody who wants to take INFACT will be getting a solid basis in food addiction. That's not the case in a lot of programs that are being spawned right now. And also, you're still bringing along the 12-step program, which I think is getting lost in some cases. Okay, so in this work, Esther, how do you keep your own head above board? How do you keep your own sanity in the insane world of food addiction?
I don't know what grace is over me, Vera. I'm telling you, I got abstinent on the 8th of February, 2003. And it was taken away from me the need to eat no matter what was happening in my life. And it has never returned, one day at a time. I think what really helps me is that I have a very stable program that keeps me abstinent, and I don't do it alone. I have a lot of support in every way, not only as a person, but also professionally. I have supervision, I have professional colleagues, and I have a lot of students becoming my colleagues and professional support as well. Nobody is an island. Nobody can do this on their own. We need to form alliances, and we need a lot of support. When we get that and are open to, we can move mountains. The power is ours, like what you say, Vera.
How can people learn more about you, Esther?
Oh, they can go into infactschool.com and just send in inquiries, and I'm happy to meet with people for further understanding. We will be setting up sessions. We'll be advertising soon where people can come in and ask more questions about the school later in this spring.
Now, is there anything that I didn't ask you that you would like to showcase about the INFACT program?
If people are interested, not only as a professional, but for their own health, for their own understanding, this school is super because we really do go into personal issues with each and every one. So people can really look at themselves as they go through the training. The counselors do what they're going to ask their clients. So we get to know ourselves in the process.
Any last words of hope to leave the listener?
I feel very hopeful. We're getting applications into the American Psychiatric Association and the World Health Organization so that they'll need to consider very strongly. So we're on the verge of this disease being acknowledged. When alcoholics was accepted, it did not mean that alcoholism wasn't there before. Only after it was acknowledged. So we are here, we have the problem, we're getting it acknowledged. And when that happens, people will need this kind of an education, for sure.
Thank you, Esther, very much for taking the time to talk to us today.
Thank you, Vera, for doing this and all that you do.
Sugar is the enemy, corrupting the minds of the teens, expelling you not to proceed. Your body's your temple, your mind is your key to a life tapped into happiness. Have it, don't dream it. If only you could see it. It's all in you and I. It's all in you